Hello, dear students. We are continuing our lectures. Lecture number 12 is drugs affecting on thyroid gland. The thyroid gland is vital hormone gland. It plays a major role in metabolism, growth, and development of the human body. It helps to regulate many body functions to constantly releasing a steady amount of thyroid hormones into the bloodstream. If the body needs more energy in certain situations, for instance, if it is growing or cold or during pregnancy, the thyroid gland produces more hormones. This organ, in medical term, glandula thyroidea, glandula thyroidea in Latin, is found at the front of the neck, under the voice box. It is butterfly shaped. The two side lobes lie against around the windpipe or trachea and are connected to the front of narrow strip of tissue. The thyroid weighs between 20 and 60 grams on average. It is surrounded by two fibrous capsules. The outer capsule is connected to the voice box muscles and many important vessels and nerves. There is loose connective tissues between the inner and the outer capsule, so the thyroid can move and change its position when we swallow. Okay? And in this picture you can see right thyroid gland and left thyroid gland. The thyroid tissue itself consists of a lot of small individual lobules that are enclosed in thin layers of connective tissue. These lobules contain a great number of small vesicles, sacs called follicles, which store thyroid hormones in the form of little droplets. And around these follicles, thyroid cells. These little things is thyroid cells. And inside follicle called colloid. And in this place synthesize the thyroid hormones. Okay, this picture you know very well, and today we will talk about producing thyroid stimulating hormone and thyroid gland hormones. First of all, hypothalamus produces thyroid releasing hormone, or TRH, thyroid releasing hormone. And thyroid releasing hormone acts on anterior pituitary, and anterior pituitary will produce, anterior pituitary produces TSH, or thyroid stimulating hormone, and thyroid stimulating hormone act on the thyroid gland, and thyroid gland synthesize triiodothyronine and thyroxine, or T3 and T4. Okay, and in this picture you can see, okay, hypothalamus produces, hypothalamus synthesize releasing hormone. This releasing hormone act on anterior pituitary. Anterior pituitary produces thyroid stimulating hormone, and thyroid stimulating hormone will act on thyroid stimulating hormone receptors, okay, and induce and as a result, thyroid peroxidase, special enzyme, thyroid peroxidase, split thyroglobulin into tyrosine, and from tyrosine and iodine synthesize tetraiodothyronine and triiodothyronine, or T4, thyroxine, or and T3. But our body needed iodine from dietary. Okay, from dietary, iodine come as potassium iodide. Okay, potassium iodide, and this potassium iodide from dietary transported into colloid by co-transporter glycoprotein. Co-transporter glycoprotein will transport iodine into colloid, okay, into colloid. This is very important moment. You should know about it, okay? If you can see at this picture, I repeat again. Thyroid peroxidase split thyroglobulin into tyrosine and other amino acids, and tyrosine connected with iodine and synthesize tetraiodothyronine or thyroxine and triiodothyronine or T3. Okay, you can see this formula from two molecules of tyrosine. This is tyrosine, two molecules of tyrosine. From two molecules of tyrosine and four atoms of iodine synthesize tetraiodothyronine or thyroxine. Tetra means this molecule contains four molecules of iodine, okay? 1, 2, 3, 4. That's why called tetra, 4. Tetraiodothyronine or thyroxine, abbreviation T4. And synthesize one molecule of alanine. And from two molecules of thyrronine and from three atoms of iodine synthesize triiodothyronine or T3 and one molecule of alanine. Okay, and these hormones enter bloodstream, enter bloodstream. Okay, and the thyroid hormones regulate the body's metabolic rate, controlling heart, muscles, and digestive function, brain development, and bone maintenance. Its correct functioning depends on good supply of iodine from diet. Okay? And disorders of thyroid gland can lead such a disease, for example, a goitre or goiter, enlarged thyroid gland due to any cause is called goitre or goiter. For the gland to be palpable, it must be at least 40 grams, okay? This is very, very large. A patient with goitre may be athyroid means don't enough iodine, okay? And hypothyroid or hypothyroid, okay? This is goitre. And hypothyroidism, also called underactive thyroid, low thyroid, or hypothyroidism. is a disorder of endocrine system in which the thyroid gland does not produce enough thyroid hormone. Okay? Symptoms of hypothyroidism include tiredness, being sensitive to cold, weight gain, consumption, depression, slow movements and thoughts, muscle aches and weakness, and muscle cramps. Standard treatment of hypothyroidism involves daily use of synthetic thyroid hormone, levothyroxine, levothyroxine, brand name Levo-T, Synthroid, and many other by trained name medication. This oral medication restores adequate hormone levels, receiving the signs and symptoms of hypothyroidism. Okay, you know this therapy called replacement therapy. Okay, replacement therapy, and other disorders called cretinism. Cretinism, congenital hypothyroidism, underactivity of thyroid gland at birth, which results in growth retardation, development delay, and other abnormal features. Cretinism can be due to deficiency of iodine in mother's diet during pregnancy. Okay, it's very important, iodine-rich dietary. It's a very important dietary. You should know about it, okay? Okay, hyperthyroidism. This overactive thyroid occurs when the thyroid gland produces too much of hormone thyroxine. Hypothyroidism can accelerate body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. Several treatments are available for hypothyroidism. Okay, and hypothyroidism includes such symptoms: nervousness, anxiety and irritability, mood swings, difficulty sleeping, persistent tiredness and weakness, sensitivity to heat, swelling in the neck from enlarged thyroid gland or goiter, and irregular and unusually fast heart rate, palpitation, and twitching or trembling. Okay, and hypothyroidism, also called Graves' diseases, is immune system disorder that results in the overproduction of thyroid hormones or hypothyroidism. Also, a number of disorders may result hypothyroidism, but Graves' disease is common causes. Okay, and very known clinical behavior, such as patients from Graves' disease patients is Graves' ophthalmopathy. Okay, Graves' ophthalmopathy. And dear students, thyroperoxidase, thyroglobulin, and iodine should be located only inside colloid, okay, only inside colloid. If they may enter the bloodstream and the immune systems of body perceives as a foreign substances, and antibodies are produced against thyroperoxidase and thyroglobulin. Okay, and most of them anti-thyroperoxidase antibody. And when in blood, high concentration, we find a high concentration of anti-thyroperoxidase antibody. This condition means means developing Hashimoto's disease or Hashimoto's thyroiditis. By name Japanese signs Hashimoto. Okay, and standard treatment for Hashimoto's disease is levothyroxine, the synthetic from thyroxine T4. However, extracts are available that contain thyroid hormone derived from the thyroid glands of pigs. These products are more thyroid, for example, contain both levothyroxine and triiodothyronine T3. Okay, this is Hashimoto's disease. Okay, now our medication. First medication, our potassium iodide, brand name iodomarin. The most rapid effect of pharmacologic doses of potassium iodide is to decrease thyroglobulin proteolysis, thereby decreasing thyroid hormone secretion. The resulting slight reduction of T4 and T3 concentration in serum cause transient increases of thyrotropin or thyroid stimulating hormone concentrations in serum. Okay, and potassium iodide has enteral doses in tablet 100 and 200 microgram. And half-life of this drug is 24 hours. Of course, this drugs has common side effects. And common side effects of potassium iodide include allergic reaction, skin rashes such as hives, swelling, or various parts of the body such as face, lips, tongue, throat, hands, and feet. Fever with joint pain, trouble breathing, speaking or swelling, sneezing, or shortness of breath. Okay, and next drug is levothyroxine, brand name Levoxil, Synthroid, and Unithroid. Levothyroxine oral tablet is used to treat hypothyroidism. It's also used to treat goiter and certain types of thyroid cancer. Okay? Levothyroxine comes in three forms: an oral tablet, an oral capsules, and injectable solution, and has internal doses from 25 microgram to 300 microgram, and parenteral doses 100 microgram per 5 milliliter. And half-life of these drugs is from 6 to 7 days. Of course, these drugs have some common side effects. The more common side effects of levothyroxine can include increased appetite, weight loss, heart sensitivity, heat sensitivity, excessive sweating, headache, hyperactivity, nervousness, and anxiety. Okay. Yes, and our third drugs is, and next drugs is antithyroid agents inhibit the synthesis of thyroxine T4 and triiodothyronine T3. And we have two medication today: methimazole trade name Northax, Topazole, and propyl thyroxyl, trade name propyl thyroxyl, okay, propyl thyroxyl, and methimazole has enteral doses tablet 5 milligram and 10 milligram, and half-life from 5 to 6 hours. And propyl thyroxyl has enteral doses tablets 50 milligram and half-life from 1 to 2 hours. Mechanism of action of this medication inhibits the production of new thyroid hormone in the thyroid gland. It acts by inhibiting the enzyme thyroid peroxidase, which usually functions to convert iodide to iodine molecule and incorporate the iodine molecule into amino acid tyrosine. Okay, tyrosine. Of course, and this medication has side effects too, and common side effects may include nausea, vomiting, upset stomach, headache, dizziness, drowsiness, numbness, or feeling, tingly feeling, rash, itching, skin, discoloration, muscle or joint pain, hair loss, or decreased sense of taste. Okay. Okay. First of all, before then prescription this medication, you should take laboratory tests. Okay. For example, in our laboratory human, we tested. We have some tests such as thyroid stimulating hormone. Thyroid stimulating hormones should be in our blood. Norms of thyroid stimulating hormones in our blood should be from 0.4 to 2.0 micro international unit per milliliter. Okay, and of course in this table you can see real results of analysis of real patient, a male patient who was born in 1988, and he has a higher concentration than norm thyroid stimulating hormone, and free thyroxine has lower than normal. Okay, and total triiodothyronine is normal. It means this patient's diagnosis is hypothyroidism and hypothyroidism, and you should prescribe to this patient levothyroxine and iodamarine. Okay. Okay, and the next real patient's results. Okay, and in this case, male patients, both 1964, and thyroid stimulating hormone lower than normal, and 0.24 micro international unit per milliliter than norm, and this is lower than norm. And free thyroxine very high. Okay, then norm, so 4.4 from 4.4 to 11.6 microgram per deciliter. Deciliter means 100 milliliter. Okay, in Latin deciliter is deciliter, international name deciliter. And total triiodothyronine T3 is normal. Okay. This analysis shows us that this patient has hypothyroidism. Okay, hypothyroidism, and you should prescribe methimazole. Okay, methimazole in tablets, 10 milligram in tablets. Okay. Okay, and next table show us real results of female patient. She was born 2000, and as you can see from this table, thyroid stimulating hormone little higher than norm, and total thyroxine in little than uh, little lower than norm, and free thyroxine in norm, but thyroid peroxidase antibodies very high. Okay, these results of analysis show us that this female patient has Hashimoto disease, okay, or Hashimoto thyroiditis. And you should prescribe to this patient Armour Thyroid, 15 milligrams tablet, okay? Okay, and as usual, you should be able to do prescription in such way, okay? RX. First of all, patient name, address name, and do prescription. For example, recipe Yodomarine, 200 microgram tablet, Denturtalis doses numerous 100, and signature 1 tablet a day. 1 tablet a day in the morning, okay? In the morning before the breakfast, you should prescribe. Okay, and next example is levothyroxine, 100 microgram tablets, and Denturtalis doses numerous 100, and signature 1 tablet a day in the morning before the breakfast. Okay. Okay. Of course, you should put date of prescription and your signs. And next drug is methimazole. Methimazole 10 milligram tablets, Denturtalis doses numerous 100, and signature 1 tablet a day. 1 tablet a day in the morning before the breakfast. And you should put date of prescription and sign. Okay, you should be able to do prescription in such way. It's very easy. Okay. Okay, dear students, let me finish my lecture. Thank you for your attention and see you next time. Goodbye.